Good morning, welcome to Fifth. My name is Levis. This morning we are going to be having a conversation that we started some months back with a lady who not only went through issues to do with fistula, has become a champion for advocating for the fight against fistula. Her name is SHARON KORIR, and she's here for us to continue the conversation on fistula and to tell us why that conversation must go on. Karibu sana.
Thank you, Levi.
Glad to have you here.
It's a pleasure. A pleasure to come. I'm always pleased to be here.
Yeah. So for those who never got your story, just in a nutshell, how did you win this battle?
Oh, okay. When I delivered my baby in 2017, so of course there's always the labor that a mother goes through. Then there was prolonged labor. My doctor failed me. He didn't come on time. So baby came out forcefully. I delivered on my own, basically. So baby came out forcefully, tore my vaginal lining all the way to the rectum. So there was a hole. Yeah, so of course that hole distorted the muscles. So I couldn't hold urine, I couldn't hold feces. And then there was an interchange of organs. I used to release my stool from the vagina, and then similarly the urine from the rectum.
And how did you manage to get that rectified?
So Levi, of course, initially I was overwhelmed. I was traumatized. It's not easy seeing your body not working the way it should be, the normal functions of the organs. Then again, you've just delivered your baby. Then I had been in hospital for 21 days because of some complications with bilirubins. Then, then before I had sciatica, I used to do crutches when I was pregnant. So I was through, I think, most postnatal depression. At some point I thought I had gone psycho. Is it that I am losing it, or is it that this is actually what is happening? I'm releasing stool from my vagina and all that. So it took me a while when I was nursing my baby. About 6 weeks later, then I remember calling my doctor, sharing my story. Sir, this is what is happening to me. I'm releasing stool and urine uncontrollably, and all the interchange of organs. And he kept telling me, do Kegels. Just keep doing the Kegels exercises and you'll be back to shape. So I did that for 6 weeks and no change. So I remember calling my sister-in-law in Kenyatta. She's a nurse in Kenyatta, and I shared with her and I told her, things are not okay. I'm not fine. My body is failing. This is what is happening. So she advised me to do Kenyatta Hospital, because normally there are camps that are there. You're screened and then they diagnose your fistula. And then, yes, you can get surgery. So I was diagnosed with rectovaginal fistula. Then, yes, I got surgery after.
And wow, even the way, it's quite traumatic even remembering that.
Yeah. It's not easy. It's not easy. It's not even easy talking about it, Levi. I thank God I can right now and comfortably. I've been doing this for a while. But then again, there's always that feeling of the chill. It's not easy releasing fistula, urine and feces from the. It's not easy.
Yeah.
It's a very traumatic experience.
It is. It must be. And we can only imagine so many women undergo that.
Yes.
So since you were on diagnosis and you had to, I'm assuming you had to had to go through surgery. There was also the post
the healing process and all that.
Yes. Yeah, and all that, not only just physically but also mentally. Why did you decide not to keep quiet about it? Many people could have gotten, it's not an everyday topic. People would decide, what, I'm okay. So
Levi,
life goes on. Somebody decided, I'm okay, so life goes on.
It's true, very, very true. So at that time, Levi, first the surgery itself is very invasive, because I was stitching on muscles. And I remember I had a very supportive surgeon at that time, Dr. Kisa. Took me through, this is how we're going to construct your vagina and your rectum, and this is how it's going to be after. So he took me through the psychological aspect of it just before surgery, then when I went for surgery. After the pain, about 3.5 hours, then there's always the procedure before surgery. You take medication to flush out all the, your system should be extremely clean, releasing all the, the roughage and everything else in your body. So the surgery was successful 100%. So the healing process is another thing again. Healing by the day is easy. The pain, the swabs of antibiotics, every weekly consultation with a doctor. Yeah, to a point now when you're 100% fine. That's about 6 months later, and very expensive as well, because you can imagine going to the doctor on a weekly basis. to ensure that you've been swabbed, antibiotics to ensure that there are no infections, because sadly they have to do their functions. You still have to release urine, and you still have to, you know, discharge stool. So you're prone to have infections in that season. Then after, of course, the physical healing, there's always an aspect of the mental part as well. Most of us, the beneficiaries of the foundation, including myself, we have an issue of validation and affirmation. Levi, are we able to satisfy our husband sexually? Are we able to, even ourselves, are we sex on our end, you know, because you see the construction of the organs and all that. Then it took me like a year to be able to speak about it, because I didn't even want to think about fistula. It made me feel sore. It made me feel bitter, because why would this doctor come late? You know, it made me, then having a small baby, also trying to regain back immunity because he had a blood exchange. So for that season, I was a bit aloof. I was so aloof. I didn't want people really in my space much. I was still regaining, back my confidence and the energy levels that I normally have. Then a year down, I go to the salon to do my hair. And in that salon, there is a lady who stood after, the lady said to do your hair. So she stands, and then she all soaked with the urine on her skirt. So what I did is I called the lady who owns the salon, and I told her, I think this lady is not fine. Is there a problem? So she tells me that's how it's been. She's been coming here once, twice, thrice, and it's the same thing. All her skirt licked up with urine, and she feels uncomfortable. You know, the way you don't even have, it really weighs you down. You don't know how to start standing. You don't even know what to do. So it's when I told her this lady has fistula, and I got her contacts, and from then on I said, you know what, we need to speak about this, because she didn't even know she had fistula. She thought it was, the way you normalize COVID, and then you start doing masks. She had normalized the situation. She was using sanitary towels, which of course leak, and had quite disappointing sometimes. And yeah, now she's gotten surgery. Life has gone back to normal.
Yeah. Has it been difficult going forward? So then you began a foundation, and how was that like? What was the transition into the foundation? You started with this lady, then at what point do you think, no, let me do en masse foundation, talk to people? At what point did that come about?
So at that time, when after now I talked to the lady, and she was willing to get help from Kenyatta and all that. I got a YouTube channel in the closet with SHARON KORIR. So I started speaking about my story on fistula. I even got other ladies to speak about their story on the same fistula in the channel. Just very deep conversations, fistula and how the stigma associated with it, what they have encountered, how their healing process, the kinds of fistula, because it varies. Mine was 4th-degree tear, that those who only have incontinence, they can be able to adopt to the environment and see how they can survive with fistula even for 20 years. So I did the YouTube channel. Then from then on, I started doing on other mainstream newspapers. Slowly, I was on mainstream, TV talking about fistula. To a point where now I think God gave me the burden and told me, Sharon, we need to set up a foundation, the Save a Woman Fistula Foundation, to be able to be a beacon of hope. Levi, a beacon of hope for women, to find mental healing, to share our experiences, to connect, to build relationships, so that we can be able to share this experience, part of mental healing. Because at that time, we know, Levi, we live in a society where matter sexuality is not easily talked about. Yeah, we easily.
And I think most husbands would run away from the issue, really.
Others would even think that you become all of a sudden untidy and unkempt and clumsy. Maybe you mejiachilia, kind of thing. You have completely let loose. You have forgotten that you have a family here and you need to be tidy. They overthink it. Others even think that, maybe those in the rural areas have an aspect of thinking about witchcraft. What did you do?
Even where I come from.
What went wrong? Where did you go wrong? Where did your family? You see, the way they connect.
When they go down the family tree and discover Uncle so and so and this so and so, they did XYZ.
Yes.
And this is why.
Exactly.
I know. That happens. We're Africans.
Yes.
That happens quite a bit. Now you have been talking for quite some time. You're famous.
Wow.
Are you aware of that, by the way? I mean, you're everywhere now. I'm
a humble girl from Keisha County.
Now you've been talking for quite some time, and tell me, what do you think has been your greatest satisfaction?
Levi, talking about fistula and seeing that I've impacted lives, You know, seeing beneficiaries of the foundation coming out boldly to go to you know, to their whatever forum, whatever mainstream media, whatever platform, whether it's in the church, just to speak about fistula and create awareness, and be able to assist another sister, you know, and see women get healing through surgeries and bringing back their smiles is satisfaction. This far. We are, yes, as a foundation, I can say for a fact that we are still in our inception stages. We are still not there yet. But the few in which that have come, about 30 women, to us to get assistance, has been a great help. Even fine, we may not be able to give the financial support because we are not there yet, we've not gotten funding, but at least being able to walk with them and talk with them and even refer them to organizations that can do the surgeries. Yeah, and you see a woman calling you and she's telling you, know what, I have gone through surgery yesterday, this is what I'm doing. I take her through how she'll be doing the cleaning when she's home and all that, and seeing to a point where now she's completely healed and she's happy. For me, it's satisfaction, Levi. Yeah, restoring that woman, that dignity, where a woman now can be able to be intimate with her spouse. A woman can be able to go back to her daily activities. A woman can be able to raise her children and cook. Because ideally, you cannot cook when you're leaking urine and feces. You can't. You can't do the daily duties. Then a woman eventually getting back her self-esteem and confidence. That's it. Yeah, that's it. So those are the things that I feel like, you know, we are working on as a foundation, and we are in the process of doing, yes. Yeah. Yeah, and we have, for some few, yes, we have achieved, yeah.
Yeah. So you did a big launch recently. How was that like? And what was that about?
Levi, the launch was amazing. Because for one, I got partnerships. I got organizations, civil organizations that came in to support us 100%. I got support from Federation of Women Lawyers. I got support from Kenya Human Rights Commission.
You were launching officially for the first time?
Yes, it was the first time launch. It was in the Hill Park Hotel, and we also did it on live on mainstream media. So we captured audience. Yeah, and then we even be able to also made a platform to create awareness, because now we could be able to speak about it and have women who across the counties to come and share their experiences on what fistula is and what they went through, you know. So part of having different, not just from me, the founder, but different experiences from different women, show that it's a disease that happens to everybody, and it's not only a poor woman's disease. Yeah, it's a disease that happens across regardless of the fact that majority of the women who get fistula are poor. Yeah.
Are you reaching out to the men to inform them as well?
So Levi, at the moment now, we are still at the inception stages, and we can only reach the average class through social media. Yeah, and through mainstream, you know, like mainstream media, like this opportunity in class. So you can imagine the women who cannot be able to access the TV. Yeah, the radios, because they probably don't have electricity. Those are, sadly, we cannot be able to get to that target group. Then even the men as well are getting inspired, because they get to listen, they get to understand, they get to relate. Over time, there's an impact though. However, we hopefully with time, as we get funding, we can go to the marginalized areas. And we partner with the correct organizations, the proper organizations that can assist us, go to the grassroots level, speak about fistula, get people come out and, you know, and get treatment through surgery, then again help them to get mental healing, then help them to reintegrate back to the society, because the society is still, you know, having that perception it's witchcraft. So if we can be able to teach, you know, the society that, you know what, the person simply had fistula, so please accept her back. It wasn't anything about witchcraft. Welcome back to the society. Welcome back home. So it's a whole, you know, it's a whole process from creating awareness to the surgery itself, to the mental healing, then again reintegration back to the society. Yeah.
So right now you said you're mostly on social media. How do you intend to, what would be your dream in terms of impacting the people who are in the villages out there?
Well, my dream is to go there, to actually have a team of especially those who are fistula survivors who have gone through it, more of advocacy campaigns and all that, where we can have the teams go to the county levels, go to the marginalized areas, be in a position to create awareness, because it's one thing, no one knows about fistula, hardly, because it's not in our curriculums. We don't talk about matter sexuality, as I said, Levi, in our communities. Those are things that are very discreet, and you cannot even speak about them close to your father and mother and all that. So be able to talk about it freely the way we do cancer. You know, make fistula a household name. Yeah, be able to speak about it, be able to address it. Anybody in your space leaking urine or feces can get assistance. And then after that, of course, in the marginalized areas, get women, get assistance through corrective surgery, and then life can, and the healing process, and life can go back to normal.
What about costs, as far as surgery is concerned?
On average, Levi, the costs of surgery is about 30,000 Kenya shillings. That's on average, that's in Kenyatta Hospital. So then the question comes in is how many women can be able to afford that? Hardly. Then sadly, our insurance covers do not cover child-related injuries.
Yeah.
That's it. Then another thing is that the healing process is also quite expensive because you can imagine the weekly consultations to avoid infections. So sadly, most women cannot be able, they may have fistula, they may be told that they do have fistula. Then the next thing is charges and costs. So those are the gaps that are there. Hardly are women able to get assistance because they cannot afford it.
Yet there are people, you know, do you realize there are people who may be listening to even the discussion of fistula for the very first time?
Yeah.
I mean, it took me knowing you for me even to even know about it, to be honest. Is it better out there? Are the Western world more in touch with this? Is this a thing for Africans only? You know, people ask.
Yeah, most of us, in fact, when I talk about it, is when most of my friends who are in law school with, you know, where my colleagues, this is when they're realizing there's fistula. Nobody really knows about it. Nobody knew. I did not know about it. Had I not gotten the condition, I had no clue what it is. Then again, if you talk about in, you know, other European countries and all that, normally they actually get fistula, but the good thing is that they don't stay for long. The doctor detects very fast that they have fistula and then they can get help, surgeries. As compared to us, we barely have a handful of surgeons who are trained fistulas, you know, purposely for fistula work. Most obstetric and gynecologists don't even know. I remember, as I said, I called my doctor and I told him, you know, this is what I'm going through. He told me, no. We did the post-stitching, you know, the way women are stitched, you know, after birth. You're fine. Keep doing Kegels and you'll go back to normal. So he didn't even detect that I had fistula. Had it been in Europe, I'd probably gotten just the same surgery, probably the same day or that season in hospital before release. So that's the thing. But fistula happens all over the world. All over the world, the fistula is obstetric fistula, especially. Those are fistulas that actually happen all over the world during childbirth.
Yeah. One would ask themselves, is there a way to prevent this from happening?
Yes, Levi. We can be able to prevent obstetric fistula, especially obstetric because of delivery, of, you know, during the childbirth, through preventive measures. What we can do is that we can ensure that women get proper family planning methods, so that by the time they're getting their babies, they're prepared to ensure that they deliver in a hospital or even in a health center. They are set to deliver with a midwife or even a trained doctor. You know, so those are the things that we are trying to put into place as well, especially in the county level, to ensure that women give birth when they are certain that, you know, they get pregnant when they're certain that they'll be able to deliver health in proper conditions. Then again, preventing measures is basically to train also our personnel, to train the doctors, to ensure that the medics also frontline. The role of the medic comes in. They ensure that they come on to the labor wards on time, to ensure that once the patient is there, they have to be there on time. The role of the doctor comes in so handy, or even the nurses, the profession itself. They need to be diligent with their work. Yeah, so a lot of expectations is more on the medical fraternity, how they deal with their clients, regardless of whether you deliver in Nairobi hospital or whether you deliver in a rural hospital in the village. They need to be very vigilant and to ensure that they do and they are there on the right time.
And that they are doing the right things.
And they're doing the right things. Because my doctor messed me up. Levi, I pushed my baby alone, literally. So you can imagine it, I was completely torn. By the time he came, baby was already out. You know, he was busy cutting the umbilical cord and I'm wondering, where were you when I went through pain? Then, of course, I really bled at that time. But yeah, we thank God for healing. And maybe God knows why.
Yeah, and perhaps, I was about to tell you, in fact, maybe if that hadn't happened, we might not have been seated here today.
Yes, and then at times I go like, you know, God has a reason for everything. In fact, in my space right now, I feel like I can be able to connect. You know, I can connect to that woman who is poor, who gave birth, you know, who's leaking urine, who, you know, who is going through humiliation and frustrations in her marriage, or even who's been neglected for some reason. Yeah, so I totally understand that that woman in a nutshell.
Yeah. It's a silver lining. We'll take a break on that note. We're on 59 minutes. We're talking with Sharon KORIR. When we come back, more on the conversation about fistula. Don't go away.